Hey, this is Sarah Baroni. I am doing my CVAD dressing change skills for critical care. I have printed all the supplies because I don't have a CVAD dressing change kit. So I have a mask, I have clean gloves, I have sterile gloves, I have a tape measurer, I have my bio bag, alcohol swabs, two ChlorPreps, a bio patch, skin prep, and Tegaderm. So before you actually perform this procedure, you do want to wash your hands and provide any kind of patient privacy. So pull the curtain or close the door, introduce yourself, and then you want to identify the patient using two identifiers. So their name or their birthday. You want to ask if they have any allergies, and you also want to do an environmental check while you're there. So make sure that the brakes are on the bed, that there's no frayed or suspicious looking wires, and then you're gonna get all of your supplies and before you head back out of the room, you do want to let them know this is the procedure that you're going to do. Do they have any questions? Do all of your patient education and answer as many questions as you as the patient has before the procedure. That way you can ensure that they feel comfortable and that they know what's going to happen. So then you'll go out, get your supplies. So hopefully the facility that you're at has a kit, and then you can just grab your kit. And then you'll go back in, check the doctor's orders just to ensure that this is the correct patient, this is the correct procedure. You'll enter the patient's room, and you can set your supplies at the patient's bedside, and then do a hand washing. You're going to actually put a mask on yourself and a mask on your patient as well. And you will ask them if they can turn their head away from the procedure site. So if they have the line here, they're going to turn their head this way. And then if they have the line here, they'll turn their head away this way. That way they're not like coughing or breathing or anything on the procedure while you're trying to clean the line for them. You do want to make sure that you raise the bed up. That way you're practicing good ergonomics as a nurse and you're not hurting your back. And then you can also prop like a pillow underneath their arm. But you do want to make sure that that line stays below their heart level, because we do want to reduce the risk for any air embolism that they could get from this procedure. And then once you have your mask on, you will need clean gloves, and you will first inspect the site. So I'm going to use this as my line. So what you want to do is inspect and palpate the line before you remove any dressing. Because we have a transparent dressing on here, we can see through. We can check for any redness, any swelling, anything that just looks abnormal before taking that old Tegaderm off. So then you want to remove the old Tegaderm that the patient has, and you will remove the old bio patch that's on there as well. Then what you want to do is you want to take your tape measurer and measure how much of that catheter or how much of that line is actually outside of the patient's body, because we're going to be working with the line, we're going to be cleaning it and lifting it up. So we want to make sure that we haven't pulled it out of place, and we want to ensure that it stays in the proper area that it's supposed to. Then you're going to discard everything in your biohazard bag, and then you'll perform hand hygiene again. You will get your kit per your hospital protocol, and you'll open that up and hopefully you will have sterile gloves in there. If not, you brought some with you from the supply room. Open up your sterile gloves and make sure that you set up your sterile field so that you're not reaching over and cross-contaminating your sterile field. So you do want to keep that in mind as well. So the first thing that we're going to grab is an alcohol pad, and you're going to clean in a circular motion right around the client's line, central line, for at least 30 seconds. This ensures that you really scrub down their skin to make sure that all the bacteria or any bacteria that might have collected under that transparent tape is kind of, you wiped it all away. You got it all, so we're not going to have an infection. Then you're going to crack your first chlorhexidine, and you're going to use that in like a back and forth motion and scrub it right underneath, right around and right underneath that line. This is a second defense so that we can ensure that the patient does not get an infection, that we have in fact gotten all of the bacteria off of the patient and off of the patient's skin to prevent it from going and entering into the patient's body. Then you're going to take your second chlor prep and you're going to actually crack that open and clean the physical line. So what you want to do is work from the site of insertion outwards, and you want to make sure that this air dries. So don't blow on it after you've cleaned it, because then that doesn't make it clean anymore. It causes bacteria to go from your mouth or whoever's mouth that's blowing on it to come, and it can cause an infection if it gets entered into the line. Then you have to start the process all over again and make sure everything is clean. So once we let this air dry, we're going to apply some skin prep to the patient's skin, and this just goes like right around the line, and this ensures that the patient's going to be wearing tape or a Tegaderm on top, so this ensures that you're protecting the patient's skin while we have a lot of that tape on for a long extended period of time. And then what you're going to do is you're going to get your new bio patch and stick that on. Make sure that it holds the line in place. And then what you can kind of do is you can kind of coil the rest of the line next to where the insertion site is. And you'll take your Tegaderm transparent tape and stick that together. That way you can ensure that the line is in place. And you're going to take all of your everything that you used that was dirty, and put it in your bio bin. And this little Tegaderm also comes with a little white label. So what you want to do is you want to write your name, your initials, the date that you performed the procedure, and the time that it was performed. That way you can ensure that whoever's coming in next, whether it's a nurse or a healthcare provider, they know that this was cleaned at this day at this time, and they know what nurse did it with the initials. And then you're going to dispose of all of your bio bag into, hopefully there's a bio bin inside of the patient's room. And then before leaving the patient's room, you do want to wash your hands again after the procedure. You want to make sure that the call light is within reach in case the patient needs you or feels like something's weird, they can call you. Ensure that the bed is at the lowest position possible. Do your last environmental checks. Make sure the brakes are on the bed, and just let them know if they need anything, they can push that call light button. And then the final thing that you're going to do after you've washed everything and come out of the patient's room is document the procedure. You want to document everything that you did, anything that you saw, whether it's, bruising, or if you had to start the procedure and then you had to call the doctor because something just didn't look right. So you want to make sure that you document everything, and you want to document how well the patient tolerated the procedure as well. And that's it for the CVAD dressing.